let's get going.
Thank you. I was muted. Apologies. Good morning, everyone. Yes, my name is Trudy McInnis, and I'm the Director of Preventative Health and Renal Policy in the Indigenous Health Division in the Department of Health in Canberra. As part of my role, a big part of my role is managing the TIS program from the Canberra perspective. Apologies, I've just realised that I put the 12th of August on there, and clearly it's the 13th of August. Next slide, thanks. And I'd also like to acknowledge that I'm presenting to you from Ngunnawal country, to pay my respects to Ngunnawal elders past, present and emerging, and to acknowledge all of the Indigenous people participating in this video conference today. I also will be touching on things that Raglan and Tom have already raised, but I guess I'm raising them from the Commonwealth public service perspective. So what's happened over the last year? There was a new release of data by the ABS from the National Aboriginal and Torres Strait Islander Health Survey 2018-19, and what it told us was around 4 in 10 Indigenous people aged 15 years and over are current smokers. That's 41%. I think Tom mentioned previously that for non-Indigenous smokers it's around 12%. 37% smoked every day, and another 3% smoked but not every day. The proportion of people who smoke every day was 4% lower. That's good news than the last time the survey was conducted. It's about the same for women and men. It's higher for people living in remote areas, significantly higher, and that's also been touched on as well by previous presenters. Lowest for people aged 15 to 17, so the younger people are coming up not smoking to the same rate that their predecessors did. And people aged 15 years and over who smoked every day averaged about 12 cigarettes a day. Next slide, thanks, Ben. The good news is that Thank you. No. Yeah, the good news is that the proportion of people aged 18 years and over who smoke every day decreased in non-remote areas over the last 14 years from 49% to 37%. And as I mentioned, the proportion of young people decreased from 77, for those who have never smoked, from 77 to 85. And for those aged 15 to 17, from 43% to 50%. Sorry, for those aged 18 to 24 years. So that's really good news. Young people aren't taking up smoking the same rate as their parents or cousins or aunties and uncles older cousins or aunties and uncles might have, and that's really awesome. The proportion of people in remote areas, and this is the bad news, aged 18 years and over who smoked every day did not change significantly. So that's why all of the jurisdictional workshops are really important, but this one is particularly important because, as you probably know, most of Northern Territory is classified as remote. So you're really a strong target population group for the program at the moment. Next slide, please. Thank you. So we've expanded in response to our priority of targeting remote areas. We've expanded the number of RTCGs in the Northern Territory and in the Torres Strait by 4. So technically it's 4. It's a bit tricky because IUI is doing the work in the Tiwi Islands, but it's a new area for them. So it is new for us. It's new for TIS, although IUI isn't a new participant in the TIS space. And Congress has been given some additional funding to do work in Alice Springs. So welcome to those of you from particularly Tiwi Islands and Torres Strait, and from Whirlijang, pardon my pronunciation. It's fantastic to have you on board, and we look forward to working with you from now on into the future. We've commissioned Circa to do a more in-depth evaluation of the sites, of these remote sites, because there isn't a lot of evidence around what works and what doesn't work in remote areas. And so this is an opportunity to try and build an evidence base so we can really understand why it is that smoking is decreasing in other parts of Australia, but for Indigenous people, but not in remote. And I understand that it's similar for non-Indigenous, but of course we're focusing on Indigenous, and we know that there are differences in terms of motivations and contextual reasons why people smoke between Indigenous and non-Indigenous. So it's really important for us to find out what's going on there. And the NBPU, we funded to have a resource dedicated to supporting the sites. And I understand that that's our Zoom operator, Ben. So congratulations, Ben, on that new position. Next slide, thanks. So what else has happened over the last year? David Thomas, who will be presenting shortly, is chairing now a new Northern Territory Remote Indigenous Tobacco Control Working Group. So every state and territory has a partnership forum that involves the state government, the Commonwealth government, that being the Indigenous Health Division that I work in, the NIAA and some other the peak bodies for Indigenous health in that state or territory, and PHNs basically. And the Northern Territory one's very big, excuse me, and active. Because of the situation with smoking in the Northern Territory, it was agreed by them that there would be a working group that would sit under them that would focus specifically on smoking in the Northern Territory by Indigenous people, and Professor Thomas is chairing that. So that's a fantastic thing that we've been able to pull together over the past few months. It's met, I think, 3 times so far. And I'll leave it up to David to talk more about how that's going. Next slide, thanks. We also convened a Smoking and Pregnancy Roundtable on the 20th of February, which seems like a million years and another lifetime ago, given everything that's happened since then. It was expertly chaired by Professor Karma. We had about 35 participants, and of those, about 15 presented. So it was a very rapid fire presentation type situation, but it was really rich in terms of perspectives and advice and information. And we've hired a scribe to take down notes, and we've ended up now with this really fantastic report that we're going to disseminate widely. So you'll all get a copy of the report, and we're going to disseminate it to anyone who might in any way touch this space. Because some of the greatest minds in Australia that have been working on this presented at that conference. So we're also going to be having videos posted so everyone can take something away from that event if they wanted to, and they'll be all on TISRIC hopefully in the next week or 2. Thanks, Ben. So there used to be an advisory group that looked after the NBPU, so provided advice to the NBPU, and with having operated now for several years, I think the NBPU probably doesn't need that. And so that group has now turned into a technical advisory group for the whole program. So it's got a range of experts on there and people working in TIS who can provide advice to us on what future developments or current issues in relation to TIS. So that's chaired by Professor Karma, and it's met once so far in May. In terms of administration, so Circa finalised the performance report and activity work plan, as you know, and we've completed deeds of variation that changed reporting timelines for you. So that happened a bit of time ago now. Thanks, Ben. We've continued to work with the ANU, so the work that Raglan was talking about, we fund that and we manage that contract. Circa, the work that Tom was talking about in terms of the evaluation, we fund that and we manage that. We work very closely with Tom, so that's a really fantastic thing that we have that close connection with Tom and able to really have informed work and thinking around what we do from Tom's perspective. We manage the quit lines, and we probably haven't given them enough attention recently, so we're starting a project where we really get more involved with quit lines and see how they're going. The same with Quit Skills. They have a new manager, Sarah Agius, who we've been in contact with, and we're going to be looking at how Quit Skills might be further refined or expanded or adapted or provided into different stakeholder groups, or because it's done such a good job up until now, where else can we take it? We work with, as Tom mentioned, and as you would know, we have this separation now between day-to-day grants management. So we do what's called program management, and then in another department, they manage the day-to-day-ness of the grant. So they do sort of accountability, acquittals type stuff. And then we in the NDPU look more at the substance, although the NDPU just provides advice and we're the ones that hold the responsibility for that. So it's a bit tricky. We have a good relationship with DSS and their grants officers, so that's helpful. It wasn't anyone's decision at my level or even a few levels above for this to happen. It came from a much senior point, and we have to live with it and make the most of it. And we commissioned the University of Newcastle to further roll out its Sister Quit program, which is now called iSister Quit. And I need to take this off my presentation because originally I was, for other jurisdictional workshops, handing over to Gillian, and she'll be talking separately on her own about iSister Quit and how that's going. Next slide, please. So when COVID-19 started to hit a few months ago, we had a few organisations, TIS-funded organisations, come to us and ask for their TIS staff to be reallocated to COVID-19 responsibilities. This happened in other programs across the division that we manage as well. We made a decision to allow that to happen on a case-by-case basis, and but didn't encourage it for reasons that we thought that working on TIS was also working on the COVID-19 response, in that people who smoke are at potentially greater risk of contracting it, and have higher vulnerabilities around that. As it's turned out, a lot of the areas where TIS is delivered, particularly in your area, in your territory, haven't been too badly affected by COVID-19. Even in areas where it is quite bad, so Victoria, they're still working on TIS. There's only been a couple that reallocated their staff, and our expectation is that they would have now that staff working back on TIS again. And just a little bit of trivia we found out last week. It was in the NDPU newsletter, so you might have all seen it, that VARS was doing this great initiative of having face masks with Quit Smoking marketing material on the front of it. So there's a state that's heavily affected by COVID-19 but have chosen not to reallocate any staff to support the COVID-19 effort, but to really double down on their efforts in relation to supporting their people to quit smoking. Next slide. So our plans for the coming year, we will want to continue to focus on remote and pregnant women. Closing the gap targets for healthy birth weights are quite ambitious, and it's seen now more broadly than just those who work in the TIS space that encouraging women to not smoke during pregnancy will assist with achieving that target. And so there's a bit more attention on, much more broad attention on the work that we're doing in relation to pregnant women in order to meet that target. continuous quality improvement, as I've said, we're looking at more intently at quit lines, quit skills. The MVPU is doing a thematic review of your activity work plans. So just to get a sense of what TIS funded organisations and TIS teams are working on, where they're putting their efforts and attention, if there's a lot of effort and attention in one particular area but not so much on another, and why that might be, and are there gaps and so on. So it's always good just to have a look at what's going on and try and unpick what motivations are for focusing on different things, and seeing if we can step in and provide more support and assistance in that regard, should that be an outcome of that work. And yeah, just continue to work productively with stakeholders and work on identifying the best use of resources. Next slide. And that's it for me. Any questions? I'll take that as no. But again, really excited to see all of you, and particularly the new participants from the site. So welcome, very, very warmly welcome.